Good morning, Miss. Thanks for your time for this review. So it's been 7 days after your surgery. You came from UK, and I would like to ask you a few questions so that other patients can hear about your experience. So, what was your main problem that brought you to Ankara, Turkey, to our clinic?
So basically, I had a sister cell repair in the UK, and it failed after 6 months. I did ask my surgeon if I was all right to exercise. She told me I was absolutely fine, but my body gave way. So 2 years later on, I was scheduled to have surgery in the UK, except they were not going to do a perineum repair. They were willing to do a sister cell and a rectal cell repair, but they were not willing to do a perineum repair, and I needed a perineum repair urgently. So I looked you up. I did look at some of your reviews. You are not that much of a cosmetic surgeon. You're more like a gynecologist, like a proper doctor. And that's why I communicated with you. And I actually started communicating with you since February 2025.
Yes.
And every time I texted you and communicated with you, you actually found the time to text back. So other people would have been like, oh my God, what a bother. Like, how many times can you text about the same thing? But the fact that you always communicated, you always remained professional, that's the thing that actually encouraged me to come here.
Thank you.
And when I did speak to you, you actually knew what you were talking about. Because it's not my first time. I do know about the surgery. And the other stuff you said was something I already knew. But the fact you told me reassured me with coming here.
Thank you. So you decided to come to Turkey for your surgery, and you told me that you had 5 deliveries before, and you had some problems with urinary incontinence and also rectocell and cystocell. So you had your surgery under sedation. Did you feel anything during your surgery?
No, thank God. It's my first time having surgery under sedation. I was quite worried. But actually, it's the same as a proper anesthetic.
It's like general anesthesia, the same feeling, but
without feeling sick afterwards. Like, I was actually quite conscious. I'm surprised because, thank God, I mean, I've not had a sedation thing before. I thought I would wake up feeling cut, but actually I slept through it, which is impressive.
You didn't feel anything?
No, thank God.
It was sedation and local anesthesia. And when you woke up, how was your pain? How did you feel right after surgery?
To be honest, I'm quite sensitive. So right after surgery, I was in pain. And luckily, you guys did give me more morphine. And that immediately calmed me down. The pain was there, but it was way more bearable. I mean, having quite a few surgeries before, I really needed that shot. And you guys did give me that.
How was your first week after surgery, like at the hotel? Because this was an outpatient surgery. You did not need to stay at the hospital, and you went back to your hotel. How was your first week? Is there anything you would like to share about your experience with other patients?
If you're coming to do this by yourself, make sure you've organized your food. Beforehand, make sure there's a restaurant that's actually going to deliver the food, or you need to speak to the hotel. Make sure you've got somebody in the hotel to get you waters. So I was lucky enough to get food whenever I wanted and to get water. But if you're going to depend on yourself, then get a Turkish SIM so you can order food through an app.
Because the applications do not work with the... But I remember with other patients, they were using the applications.
I think they must have gotten it done before.
No, because one of the patients, I remember, she gave my number. She asked if she could give my number so that she could order. We couldn't think about this at your case.
Okay. It's okay.
Because every time they brought the food, they were ringing me.
Oh, okay. That would have been very helpful had I gotten that.
Yeah, I forgot. Now when you say, I just remember because she was ordering food. Okay.
It's okay. So, it's just the food part.
That's very convenient with a Turkish SIM. Then you can, because there are many apps for the food.
Or either set it before coming, because I'm not planning to have surgery again. But if I did come, I would definitely get a Turkish SIM. I do have my son's friend who's in Istanbul. He's been ordering me stuff through the Amazon, and I've been getting it. But that would have been really helpful.
Really helpful.
Had you offered that as part of the patient service.
We should
be fair. You do put them at ease.
Exactly.
Yeah.
But now I just remember that one of our previous patients from Canada, she was very young, and she asked me if she could do this, and I said okay. And now I remember when you tell me.
You had a lot of patients. You were too busy, and
yeah. But this is as much as I can remember to ask. But if there's anything else you would like to add, or if you would recommend such surgery to other patients, or any other comments or feedbacks you could give us.
In terms of the operation that I've had, I'm sure many women go through it. The only problem is in the UK it gets prolonged. So if you feel you have this problem, it's best it gets done as soon as possible. If you're definitely not going to have any more kids, because it actually changes your life. I can actually go sit in the toilet and poo without feeling there's a barrier, whereas before I'd actually feel there's something there, although it wasn't as bad as my sister cell when my UK surgeons checked. But it's such a relief to sit down in the toilet and actually use the toilet. And in terms of my bladder, normally after the operation you still have like leakage. My leakage is in the toilet, is no longer on myself. So for me this is really fantastic.
Great to hear this.
Yeah. The healing process is painful, but the fact that this is my second time doing it, and I can tell it's been done properly just by day 7 compared to my first operation, it's a big thing. It's a big thing.
I hope you will heal even better during this first 6 weeks period.
Yeah.
So you are planning to fly back home tomorrow as soon as possible.
Yeah.
So this was your follow-up visit
today.
We wish you a very good journey. Thank you for your time again.
Not
it was
problem.
Very nice to meet you.
Thank you for your
Have
services,
nice
your professional service. Thank you.
Thank you.
Done.